Hello and welcome to our channel, Hawthorne Oncology Pain Experts. My name is Dr. Edward Podgorski and I'm an interventional pain specialist and the founder of HOPE. Thank you for visiting our channel. HOPE is located in beautiful Tampa, Florida, and our expertise is in cancer pain and symptom management. Our goal will be to help you and your patients learn about all things cancer pain and symptom management. If you enjoy our content, please subscribe to the channel, hit the like button, and click the bell to stay up to date on the most current videos. Thank you and enjoy the content. Our first video series will be geared towards patients and focus on the topic of intrathecal drug delivery. The series will include approximately 10 videos and discuss topics like what is intrathecal drug delivery, who is a good candidate for intrathecal drug delivery, and what is the process for getting an intrathecal pump. Today's video will focus on what is intrathecal drug delivery and who is a good candidate for intrathecal drug delivery. So let's get started. So let's start off by defining the term intrathecal drug delivery. What do those three words mean? The first word, intrathecal, is used to describe the fluid-filled space that surrounds the spinal cord. I like to think about the spinal structures like a plumbing pipe in your home. The outer plastic barrier symbolizes the bone and some of the surrounding tissues. Within that pipe is fluid, and then suspended within that fluid would be the spinal cord. When we're talking about the intrathecal space, we're talking about the space inside the plastic of the plumbing pipe. The next two words are pretty self-explanatory, drug delivery. So overall, intrathecal drug delivery involves delivering a medication or drug to the intrathecal space. Again, the fluid-filled space surrounding the spinal cord. It is important to note that intrathecal drug delivery is not the only term used for this therapy. Another common term is targeted drug delivery. Again, the drug delivery part is pretty self-explanatory. The targeted part means that the medication is being delivered directly to the target, which are the receptors on the spinal cord. This is in contrast to taking something like oral medications that have to be processed by the stomach, get absorbed through the gut, make its way through the bloodstream, and finally get to the receptors on the spinal cord. Targeted drug delivery delivers that medication directly to those receptors, bypassing some of those other barriers that are associated with oral medication use. Finally, some other common terms that you'll see on the internet are pain pump, spasticity pump, spinal pump. All these things refer to the medical terms intrathecal drug delivery and targeted drug delivery. So you may ask how the medication gets from point A to point B. And the way that happens is by delivering the medication through what's called an intrathecal pump and catheter. This is what an intrathecal pump looks like. It's about the size of a hockey puck. The diameter itself is about 3.5 inches. And depending on the size of the pump, there's a 20 milliliter and 40 milliliter version. This is the 40 milliliter version. It's about 1 inch thick. That pump has a motor inside. There are other versions that deliver the medications in different ways, like by using gas and pressure. That medication then gets pushed through and connected basically to this port here. And it gets connected to what's called a catheter, and that catheter delivers the medication, has a little tip on the ends, and there's a few holes here. So just think of like a garden hose. And that medication gets delivered from point A, which is the pump, to point B, which is where the catheter lies, in the intrathecal space right behind the spinal cord. There are many more details about the pump, how the medication gets delivered, what are the medications used, how frequently the medications get delivered, many variables, and we will certainly get into those topics in subsequent videos. For now, we're just going to stick to the basics, and the next topic we're going to talk about is who would be a good candidate for intrathecal drug delivery, also known as targeted drug delivery. So there are there is a list of diagnoses that one could have that would be an indication for intrathecal drug delivery. But most of us like to think about who would be a good candidate for intrathecal drug delivery in more broad terms. So some of the patients that we would consider for intrathecal drug delivery would be first would be somebody who's intolerant to oral medications. Oral medications can cause a lot of side effects, nausea, vomiting, constipation. For those patients, if the medications they take cause those symptoms, delivering the medication via the intrathecal routes can be beneficial because those doses are much lower than what you would take orally. That's the first patient. The second category would be somebody who's on really, really high doses of medications. Take, for example, something like morphine. If somebody's above the guidelines from the CDC of 90 morphine equivalents or 90 milligrams of morphine per day, that would be another good candidate. Somebody who's escalating those opioids pretty quickly, they keep going up and up to achieve pain relief, that would be another good candidate. Cancer patients are great candidates for intrathecal drug delivery. This route of delivery can be very, very effective for treating cancer pain. The other indication is a non-pain related indication, and that is what's called spasticity. So patients who have spinal cord injuries or involved in a motor vehicle accident, gunshot wound victims that have the central nervous system affected can have a lot of rigidity and tightness in some of their muscles. Typically, that's the legs and arms. Those patients can get a special medication called baclofen, which is a muscle relaxant. And that helps treat and relax some of their spasticity that they suffer from. Those are the main candidates. Some of the common diagnoses would include things like failed back surgery syndrome, also called post-laminectomy syndrome, chronic back pain due to degenerative disc disease, multiple compression fractures in the back causing pain, a diagnosis called complex regional pain syndrome or CRPS, formerly known as RSD or causalgia. That condition affects usually the extremities and causes significant pain. All these things are good indications for a pump therapy. One of the important things to consider is that pumps are not used usually right away. So if you injured your back and you had a herniated disc, that would not be somebody who's a good candidate for an intrathecal pump. The pump involves a surgical implantation, so it's a little bit more invasive than other therapies, including medications and injections. So usually more of those conservative therapies get tried first. And if things escalate where you have any of those previous things that I mentioned, that's when you would start to consider things like intrathecal drug delivery or other neuromodulation devices like spinal cord stimulation. Finally, let's talk about the benefits of intrathecal drug delivery. While there are many benefits of intrathecal drug delivery, I think there are two important benefits that are specific to patients' improvement in their pain and their quality of life. The first being the amount of medication required to achieve your pain relief. Intrathecal drug delivery has been found to be 100 to 300 times more potent than oral medications. So for example, if you had to take, let's say, 300 milligrams of morphine a day to achieve that same level of pain relief, you would only need approximately 1 to 3 milligrams of morphine intrathecally. The reason for that is what we talked about previously, is that it gets delivered directly to those receptors on the spinal cord. So it doesn't have to pass through all those barriers to get to the target receptors on the spinal cord. And as a result, the second benefit is that because you are taking less medication is going to affect or cause less of these side effects that are associated with higher doses of oral medication. So there's been proven to be a reduction in some of the side effects that you get from things like opioids. So less constipation, less nausea, less vomiting. Some of the things that would actually increase potentially are things like itching, but usually that's something that goes away with time. But overall, the amount of symptoms that you would get from a oral medication or side effects from that medication would be far less with intrathecal drug delivery. So we're going to stop there today. I hope you got something educational out of this video. Like I said before, we will have a series of videos that will describe some of the other details about pump therapy. And those will be upcoming. I will try and put one out every other week. So stay tuned. If you have any questions about intrathecal drug delivery, you can always visit our website. I will put that link in the description below. Feel free to call our office. Obviously we're located in Tampa, Florida, but if you're from somewhere else across the country and you have some questions, I'm happy to answer those questions. And we can be reached at 813-538-7600. And me or my staff would be happy to help point you in the direction of somebody in your local community that may be able to help you or talk to you about intrathecal drug delivery. So again, I hope you had a good experience, and look forward to some more videos. And I look forward to continuing this education series to help you in the community achieve better pain relief.